much, John. Thank you, Chris, for welcoming us here today. Thank you to all of you for joining us for a few moments down here in the atrium of one of America's best hospitals. I really wanted to bring everyone here today, and I'm thankful for our host and our guests who are going to speak, for putting up with this insanity for as long as you did. In 1997, when this was put into place, renewed again in 2003, the intentions were good. There was a runaway Medicare budget, and the legislators felt that they had to show some seriousness about trying to control Medicare costs. Unfortunately, they did it in the wrong way by extending an indiscriminatory cut to every single provider across the country on an annualized basis without any thought about encouraging value or rewarding those professions that needed plus-ups or needed an expansion of service and scope. And the problem became compounded year after year, despite all of these fixes, such that had we not intervened, this would have been a quarter cut in reimbursement for physicians all across the country. But we now have a new formula that guarantees rate increases for providers moving into the future and provides some certainty for hospitals and physician practices who are wondering on an annual basis as to what their level of reimbursement would be. I do want to talk about the rest of this bill for a moment, because this wasn't just about a fix to the SGR formula. Kathy Yacavone will talk in a second, but our community health centers, which have grown their capacity at a time when we desperately needed them to grow their capacity as we added tens of thousands to the rolls of the uninsured, insured, we're facing a funding cliff that is exacerbated and solved by this piece of legislation as well. Included in this legislation is $7 billion of new funding for community health care centers all across the country that will allow for the expanded access that has been made possible by the Economic Recovery Act and the Affordable Care Act to continue. And so the cliff that would have occurred if physicians had taken a 24% reimbursement cut would have also occurred in community health centers, who would have had to retract a lot of the expansion that has happened all across the state. The Children's Healthcare Insurance Program is extended in this bill by 2 years. Now, a lot of us would have liked to have seen that extension be 4 years or 6 years, but it's important to know that the funding that makes Connecticut's Husky healthcare program work will be there for 2 years into the future. Let me now introduce to you my great friend, my neighbor in Cheshire, Connecticut. I commute to Hartford generally. She commutes down to Bridgeport to run Southwest Community Healthcare Center to speak on behalf of the Community Health Centers. Kathy Yacavone.
Good morning, and thank you, Senator and St. Francis, for sponsoring this event. We really appreciate it. On behalf of the 14 community health centers in Connecticut, I just want to comment and really emphasize what Senator Murphy had said, that health centers provide comprehensive medical, dental, behavioral health services to over 350,000 Connecticut residents and over 20 million persons in the United States, without regard to insurance or status. The health centers across the country were faced, as Senator Murphy said, with a 70% base grant reduction. If this legislation had not happened, as of September 30th, programs would close, providers would have had to have been laid off, providers who are so hard to recruit in medically underserved areas to begin with, hours of operation would have had closed, and the bottom line is, even in my health center alone, over 2,000 clients that we currently serve would have lost access to care. And without a senator who really gets it, where would Connecticut be? Where would our most vulnerable populations be? We would not have the health care that will now be available because because of his courage and his leadership and his determination. And on behalf of all of the clients and all of the health centers in the state, we want to thank you, Senator.